Hi, everybody. My name is Krystyna Keller, and I'm a Postbac fellow in Dr. Cayley's lab in the Social Network Method section of the Social and Behavioral Research branch within the NHGRI. And today, I just want to start off by reading some quotes of participants in our lab regarding caregiving during the pandemic. They're both bad situations on their own, but then when you put it together, they just make each other worse. Leaving the house is hard. Even before the pandemic, when we did leave the house, it was a process. We don't want a lot of contact because we felt like she probably wouldn't survive a really serious case of coronavirus. Every minute that we spent with her is important. Every event, every birthday party is so precious and so important because we know it could be the last. COVID really robbed us of that year. So these quotes are from loved ones of children with juvenile Batten's disorder, which is a disease that affects the cell's ability to process and break down waste and nutrients. Unfortunately, this disease is fatal and neurodegenerative in nature, so a lot of these children will likely decline and pass away in their late teens or early 20s. Many of these sentiments are also really shared by parents in a normative experience as well, especially during the pandemic, such as stress and limitations. But there's a really unique exacerbation that occurs in caregivers that I want to focus on in this project. A caregiver is someone who offers us emotional and instrumental support throughout a lifetime. And like I mentioned, we're going to be focusing on parental caregivers to look at those dual roles simultaneously. Caregiving in itself is an extremely stressful process, as exemplified by this first quote, and how just the disease itself really changed their life and made it extremely stressful. In addition, there are changes as well as support that are needed for both the caregivers in these situations, because leaving the house is hard, and just in that routine, there's a change. In addition, there is support that is really needed in a lot of these caregivers' lives, and unfortunately, that has been put on hold due to the coronavirus pandemic. Lastly, in the year 2020, the United States found or resulted in the lowest level of happiness in nearly 50 years. And this really just takes on a whole new meaning for caregivers because they really lost that time with their loved one. So this brings me to my question of how does COVID-19 impact parents of terminally ill children? So to explore this question, I want to examine the impact of the pandemic on caregiving qualitatively and thematically through interviews from our participants. And this project is relevant in conducting research not only in my lab and my section, but in the greater NIH as a whole, because I really feel that participants should be treated as people first and not just data points. Our research really has the potential to inform clinicians and larger institutions like the government and healthcare systems on how to best tailor resources to these families' needs. This project will give a voice to parents in devastating situations and inform future research for best practices and support in the inevitable next unprecedented time. Thank you.